Hi, everybody. I'm Audra Burns, Media Relations Manager here at Dartmouth-Hitchcock, and I'm going to be moderating today's panel. Thank you for joining us for this discussion, which is geared towards those who are really concerned about the COVID-19 vaccine and are either considering pregnancy, who are pregnant, or who might be nursing, and they might have questions about the efficacy of the vaccine. So we're excited to have you with us today. Before I introduce our panelists, I want to remind everyone that we are recording this event so that our colleagues who cannot join us live can watch it at a later time because the link will be posted on our intranet. Questions and identities are all confidential, so please use that Q&A section if you have questions for our panelists. We are excited to have two experts in this field to provide information to you and to listen to the questions and concerns that you might have. With us today is Dr. Julia Braga and Dr. Alana Cass. Dr. Braga is a doctor of gynecology and obstetrics who is excellent at listening to patients' concerns and works together with them to find practical solutions to challenging problems. Hi, Dr. Braga.
Hello, thank you for having me, Audra.
We also have Dr. Alana Cass. Dr. Cass is a gynecological oncologist and the chair of obstetrics and gynecology at DHMC. She has a clear understanding of difficult journey and decisions that patients must make and is focused on making sure that she can help guide and educate her patients so they can make the best decisions that they can. So we're thrilled to have her as well. Hi, Dr. Cass.
Good afternoon, Audra.
So if you're tuned into this webinar, we know that it's important for you to be able to get the answers to the questions and concerns that you have on your mind. So first, we're going to hear from Dr. Braga and Dr. Cass, and then we're going to open it up for questions. So please use that Q&A function and submit your questions so that we can ask them. So with that, I'm going to turn it over to Dr. Braga.
All right, thank you. It's very exciting to be here, and it's very exciting to see all of the people who have joined. We really weren't sure how many people would log in and listen to the discussion today, so it's exciting to have a lot of participants. And we really are here today to hear from you and try as best as we can to answer your questions and concerns. But first, I'll just say a few kind of updates on COVID and pregnancy, and specifically about the vaccines that are available and kind of what we know about them in pregnancy. Because luckily, we know a lot more currently than we did a year ago. If you think about where we were a year back, it was a super scary time. We really didn't know how COVID would affect pregnancy. We know a lot more about that now. We also, if you think back to a year, we didn't have the vaccines. We had no idea what vaccination would look like. And we have a lot more information and data about vaccination at this point. And luckily, we have some good data on vaccination during pregnancy, and we'll share a little bit with you about that today. And I think, the number one thing that I want to impart upon people, if there's one thing you take away from today, is just to know that all of the major organizations out there that kind of make recommendations for pregnancy and health decisions during pregnancy, such as the American College of OBGYN, the group that sort of guides nurse midwives, the major group that guides high-risk doctors for pregnancies. They all sort of unequivocally recommend at this point that pregnant women get vaccinated for COVID. 6 months ago, there was a lot of blurriness and hedging and, talk to your doctor, see if it's right for you. And now we really have enough information to say, get vaccinated. It's really in everyone who's pregnant's best interest to get vaccinated during pregnancy. And the reasons why we feel confident saying that to women now is that, number one, like I said, there's a lot more data about pregnancy and vaccination. There have been many, many women in the United States vaccinated at this point during their pregnancies. And there have been several different studies that have looked at those pregnancies and found that outcomes are really exactly the same, whether you got vaccinated or not, as far as it doesn't increase risk of birth defects. It doesn't increase risk of miscarriage. And it doesn't seem to cause problems like in the later parts of pregnancy, such as problems with the fetal growth or causing difficult complications of pregnancy like diabetes or hypertension. So that's really exciting to know that many, many thousands of women have been vaccinated and it doesn't seem to affect the pregnancies at all. And on the flip side, we now know that that COVID can be very difficult during pregnancy, and that women who get COVID while they're pregnant have a higher chance of getting very sick with it. There have been at least 4 studies now that have shown that women with COVID during pregnancy have like a 3 times higher chance of having to be in an ICU type of setting. And a 3 times higher chance of having to be intubated than someone kind of similar age, similar background who's not pregnant. So while overall women who get COVID during pregnancy do generally really well, there's this kind of smaller segment of women who get very sick, and it can be really, really scary and dangerous. So knowing that, we want to try to prevent that for our patients. That's kind of the information that we're looking at these days. And I think trying to impart upon patients the balance of the pros and the cons really seems to weigh out in favor of vaccination. So I'll leave it at that for now. And let Dr. Cass talk a little bit more. But like I said, this session is really primarily about hearing from you all and knowing what your concerns are. So we'll have plenty of time for questions.
So I'll pick that up, and I wanted to address specifically a couple of populations that may be relevant to some of you who are on the webinar today, and that's around infertility and also breastfeeding or lactation. And again, another to invoke sort of one of the societies of experts to whom we look for guidance about managing everything related to patients who are seeking treatment for fertility, if they have a problem getting pregnant, but also just the larger population of people who are trying to get pregnant. And unequivocally, again, the recommendation is based upon the science and the data that the vaccines, no matter what type vaccine, have no impact whatsoever on fertility. The vaccines do not in any way change your DNA. They don't get into your eggs or sperm. They do not alter you as a human being and who you are. And therefore, that reason, I really want to emphasize that they have absolutely no impact whatsoever on your ability to get pregnant. With respect to lactation, the sort of 2-for-1 there is that for individuals who are nursing their children, their babies, we do also know that, again, the vaccine, which is a couple of different techniques, but the concept is a small portion of a protein, which is then degraded within days, results in the production of some antibodies, which are protective, and those exact antibodies are actually passed along to the baby. And that, I think, is incredibly important right now in this really heartbreaking time where we not only see that COVID infection rates are going up, but they are increasingly affecting the remaining unvaccinated, notably our children, right? Our children for whom there's still no clear guidance, unfortunately, about getting our children vaccinated. So the vaccine actually confers protection not only for the individual who is nursing, but also for the baby. And I think this is an incredibly important inflection point with respect to our journey and what a journey it has been with COVID because of this Delta variant. And you all know, as individuals who work in the healthcare system, you walk the halls of DH in whatever capacity, you know that this Delta variant is a completely different animal, unfortunately, than where we started in March of 20. It is so much more highly transmissible. And unfortunately, because of that, so much harder to contain. And to that end, I would say that anything and everything we can do to really get this particular Delta variant under control is imperative. And I think it bears mentioning that when an individual is pregnant, it's logical that that's kind of a state of relative immunocompromised status, meaning that, of course, the fetus, which is kind of foreign to the person who's carrying the pregnancy, the body, by virtue of pregnancy, actually is almost immunocompromised, and therefore really making the point that even a healthy person who's pregnant, who has no other medical problems that we've become so familiar as risk factors for severe illness with COVID, that healthy person who's pregnant is actually very vulnerable to the COVID-19, again, notably the Delta variant. And so this is why vaccination now makes more sense than ever. And as I talk to colleagues around the country and read the what's in the press every single day, unfortunately, as we are all painfully aware, the number of admissions here in the DHH system because of COVID goes up every day. The number of patients that are in the intensive care unit goes up every single day. And unfortunately, one sector, one of the populations of individuals that's rising more and more with their intensive care unit admissions is actually pregnant people. And so really, we're just here today to try to reassure people, to answer your questions, and provide you with the updated data that really gives us very clear guidance that the vaccine is safe, it's effective, it's available, and we now know with real data that it is perfectly safe in pregnancy. It does not impact fertility, and actually confers to the baby the additional risk, the additional benefits of those COVID-19 antibodies to fight off infection in your very vulnerable newborn. So we're really all in with vaccination for all of the reasons that we've just described.
And we have a very engaged group here, so we're going to get right to it so we can help cut through the clutter here. And we actually had our first question that was emailed in for you, Dr. Cass, and it's, I've been trying to get pregnant and going through IVF treatment. Am I still required to get the vaccine, or can I defer?
That's a wonderful question, because obviously so much of the healthcare force that we work with are individuals that are looking to, young individuals looking to either start or expand their family. And the guidance from the American Society of Reproductive Medicine, or ASRM as it's known, is they very much endorse vaccination. The best time to get vaccination is before you even start on your fertility treatments. But if you've started in with a fertility treatment, you should discuss this with your specific fertility doc, because they will encourage you to finish the cycle that you've started and then go ahead and get your vaccination. The time to try to avoid getting the vaccine is when you're right in the middle of your cycle because of some of the side effects. But the American Society of Reproductive Medicine absolutely encourages vaccines, whether you've embarked upon your fertility treatment or when you're just going to see your fertility doctor to start thinking about the possibility of signing up for some treatments.
Excellent. All right, Dr. Braga, what are your recommendations for moms expecting twins and want to get a COVID vaccine or booster? Are there concerns with clot risks or any other concerns?
That's an interesting question. I don't think I've had that one yet. There's no separate recommendation for women with twins or triplets for that matter. Basically, anyone who's pregnant is recommended to have the vaccine. I don't see of any reason why there would be a higher risk in patients with twins. And as far as the clot risk, I'm sure many of you have heard about the Johnson & Johnson vaccine and how it was paused because of the very rare side effect of venous thrombosis in the brain. And I think, it's something that we haven't been seeing in pregnant women as far as I know. It's not come up in the literature as a risk for pregnant women. We know that pregnant women do have a higher risk of blood clots in general. But I think that risk with the Johnson & Johnson vaccine was so incredibly low and so rare that there's just not enough patients to know if it's something that's going to be seen in pregnant women or not.
All right,
But
great.
twins, I think 100% should be vaccinated. And in fact, all the more so because twin pregnancies are more risky as far as the respiratory compromise during pregnancy. You have these, bigger abdomen causing more pressure on your belly, or on your lungs rather. So you get more compromise of your breathing towards the end of pregnancy. So COVID could in fact be riskier for someone with twins.
Okay. I'm certainly not a medical professional, but my advice is to get your sleep now while you can. So
Yes.
moving on to the next question, Dr. Cass, what is preferable in terms of the most effective antibody transfer to the baby? Vaccination during pregnancy, meaning antibody transfer via the placenta, or while breastfeeding via breast milk?
Right. So it's a great question. And again, we're still fairly early on with our understanding of how do you get the most sort of bang for your buck with respect to antibodies. But what we do know about the transmission is that vaccination in general results in a much, much higher antibody level than you would see with nursing. So my recommendation would start with common sense to some extent about the vaccination. An individual should get vaccinated. And there is data to suggest from some of the studies that Dr. Braga had alluded to, that there is transmission of those antibodies potentially through the placenta, protective antibodies to the baby. I then recommend lactation, if possible, after the baby is born for a host of different reasons, because it has been shown to be much better for the baby to pass along all sorts of different antibodies and protect the infant. So I would say it's an and rather than an or, and we don't have specific data about one versus the other, but clearly we are all hoping that the vaccination will become available to our children as soon as we have more safety data.
All right, we have a lot of great questions coming in. Just a reminder, if you have questions or concerns, use that Q&A function and pop those in there, and they're completely anonymous. So we have another one for Dr. Braga. How many women have you seen that have gotten the vaccine and then have become pregnant? I am in the process for getting tested for endometriosis, and I don't want another factor for infertility at play. Do we have factual information on women who got the vaccine before actually conceiving?
Great question. So, personally, I've seen a lot of women who, a lot of my patients work here in the facility, and did get vaccinated pretty early on, and then certainly have gone on to become pregnant. I think there are a lot of factors at play when someone is struggling with infertility or knows that they have a condition such as endometriosis that can make getting pregnant more difficult. But getting the COVID vaccine does not make getting pregnant more difficult. So it really is not an additive factor. There's nothing about the medication that's in the vaccine that inhibits fertility at all. So I would go ahead and get vaccinated now and get it out of the way. And then, hopefully getting pregnant will not be an issue because of the endometriosis, but there's certainly things that can help with that if you need help. As far as the last part of the question, do we have factual information on women who got the vaccine before actually conceiving? So I think you're asking, do we have data on women who got the vaccine and then tried to get pregnant as far as fertility rates? I would have to look into sources for that. I would be happy to do that. But I would direct you to the Society for Reproductive Medicine, and we can put that link up on our website on the intranet. But they have a lot of good information about fertility and vaccination and why they are so strongly recommending it as not causing any problems with conception.
All right, great. Dr. Cass, this one is coming from someone who wants to clear up some of the data and where it's coming from. So they're asking, where is the data coming from? The Pfizer biotech website actually states, quote, available data administered to women are insufficient to inform vaccine-associated risks in pregnancy.
So that's a great question, Audra. And at this point in time, we have data from a couple of different sources. The first of which is a group that, as we get a vaccine, there is always a watchdog organization that is separate entirely from the companies that make the vaccine, who are in touch with patients. And one of the questions that they ask on this vaccine adverse event reporting system, VAERS, and they monitor when a vaccine is given. They ask patients, individuals who get the vaccine, are you pregnant, yes or no? And then they can do searches and stay in touch with those individuals who indicate that they are pregnant through communication. And that is one of the ways that this organization, separate entirely from the people who make, from Pfizer and Moderna, so that they can in real time have ongoing data about, for women who got the vaccine, no matter what type, what were some of the adverse events that occurred for those women. And I would point out that in this point in time, about 140,000 women who've received vaccines are pregnant with some follow-up data that has been reported. In addition to that, there are smaller studies that have been performed out of centers, for example, Israel, where they have a national reporting system of who got vaccinated, and they've monitored patients within their sort of national database. And then third of all, there are studies that come from particular institutions where they've had a lot of COVID vaccination and they've tracked and monitored their own individual experience. So from each of these three different types of studies, a large sort of collective database of everyone who got vaccine, a national database from some countries where things are a little bit more tightly monitored and followed, and then individual institutions, which have a lot of experience with COVID vaccination, because they have a very high density of patients. All three of them have conclusively shown that for women who were pregnant, there was no increased risk in things like miscarriage, birth defects, or fetal growth anomalies, as described by Dr. Braga. Moreover, they have described for women who got the vaccine that there's been no adverse impact, no worse symptoms that we're all familiar with and that we've heard of with the COVID vaccine: fevers, a sore arm, myalgias. And in fact, one of the large databases suggested that there's actually fewer of those side effects in women who are pregnant compared to women who aren't pregnant. So I think I certainly feel comfortable not only looking to my society for guidelines, but also in reviewing some of the literature. It's separate from the drug companies. It's large studies drawing from hundreds of thousands of women, and it's all across the world. And so for that reason, I think we really can some of this data starts to emerge, including, I'll just tell you all, in case you want to read it, there's a New England Journal publication that came out in April of this year, which described that vaccine adverse reporting sort of aggregate report, which is easy enough to find, again, in the New England Journal of Medicine in April. And that's what we use as our sources. And that's what experts who are in our sort of societies, our guiding societies for best practice and how we care for patients, we really turn to them as well as this literature to make our best recommendations for you all.
All right, great. We have a very engaged audience here, so thank you all. And if you have additional questions, use that Q&A. We have another one that came in. Dr. Braga, if fully vaccinated and eligible for a booster dose, should this be done during pregnancy?
So yeah, I mean, we may be at that point soon where there will be a recommendation for a booster for healthcare workers, for people at high risk. And, I think if you fit into one of those categories where it's offered, I would recommend getting it. Yep, we're going to sound like a broken record here, but yep, I think I would go ahead and get vaccinated again. And, we are seeing, as more and more of the reports come out, that the coverage of the vaccine, the antibodies may start to wane at this, 8, 9, 10 month mark. If the recommendation comes out for people to get a booster, then I would certainly take that opportunity.
All right, great. Dr. Cass, could you share what the risk is? You said 3 times higher likelihood of intubation. What is the rate?
So can't really talk about the rate per se. What we're looking at is comparing, as Dr. Braga had alluded to, if you take a pregnant group of women and compare them to individuals who are not pregnant, and both of them have COVID. So again, difficult to talk about a rate because a rate would vary depending upon where you are in the country and underlying comorbid conditions. But for everyone, if you compare women or individuals who are pregnant and have COVID to individuals who are not pregnant, we see unfortunately a 3 times higher risk, as Dr. Braga had alluded to, for intubation. And I think that the sands are even shifting, even as we talk about the Delta variant, because we kind of had a sense of, if you had 100 people that had COVID vaccination when COVID-19 first came out, we had a sense of how many of those people would, for example, end up needing intubation here in the Upper Valley based upon sort of the risk of infection here amongst our own our own region. I think with the Delta variant, I can only tell you that we're seeing in places, especially where there's a higher unvaccinated rate in the South right now. ICUs are filling up again. There are no beds whatsoever. And so really, I think we're all still figuring this out with the Delta variant, which is clearly more transmissible and therefore really makes unvaccinated individuals at that much higher risk.
Mm-hmm.
And just to add to that, I would have to pull the original source, but I think somewhere around 3 to 5% of pregnant women who get COVID infection will have a severe course of disease. So, not all of that 3 to 5% will need to be intubated, but that gives you a sense of what percentage of pregnant women who get COVID are really sick with it. And then some percentage, I don't know the exact percentage, but some percentage of that 3 to 5% will need to be intubated and in an ICU and have a significant risk of having long-term problems from it. So that gives you some sense of what percentage.
And we're also seeing, again, looking at some of the reports, that COVID infection, severe COVID infection, can actually alter in some ways, unfortunately, the placenta, probably to some extent because of the body's immune response that is so revved up as a result of fighting infection. So unfortunately, pregnant women, there have been many reports of women losing their pregnancies, either having miscarriages or the pregnancy dying, and resulting in miscarriage for women, even if they survive their course of COVID. So again, we're really thinking about pregnant people and 2 patients and how much that complicates the equation.
All right, we have a family member here who is just looking for clarification on the efficacy with the Delta variant and COVID. So they're writing, my stepdaughter is 5 months pregnant and got her first COVID vaccine as soon as she was eligible back in April or May. Then she found out she was pregnant with baby number 2 and waited a few months before getting the second dose. How does this vaccine protect the variants where most studies done were on COVID-19? So the data was on COVID-19 and not on the Delta variant. So can you maybe, I think what they're looking for is explaining how is it protecting against this variant?
From what we know, the fully vaccinated people have quite good protection against the Delta variant. And, I think this is like a classic, viral illness where every season and every year, we may see these variants, and they're going to be working to change the vaccines to try to maximize the success rate against the virus. But so far, people who are getting the Delta virus or getting exposed to the Delta variant who have been vaccinated are doing much, much better than people who have not been vaccinated. So it seems to be quite effective.
And just to tag on to that exact point, I would remind everyone that unfortunately we find ourselves in this ongoing crisis, that the COVID-19 severe infections leading to hospitalization, leading to ICU admission, and leading to intubation, it's largely 96 to 98% unvaccinated individuals. People who are vaccinated may have some symptoms if exposed to the Delta to the Delta variant, but they have a much milder disease course. And other than the incredibly immunocompromised patients, none of them have really had to be admitted into hospital. None of them have required ICU admission or intubation. Unfortunately, this is largely a disease right now of the unvaccinated.
Great, excellent point. Dr. Braga, this is another one for you about something you mentioned earlier. So would pregnant women be allowed to get the booster now if they're considered immunocompromised, especially if 8 months out from the second shot?
It's an interesting thought. Pregnancy is not on that list of considered immunocompromised states where the CDC is recommending to get a booster. I think it's very strict criteria right now for who they're recommending a booster for. But it will be interesting to see if pregnant women are put in the forefront kind of as the next group to recommend boosters for, along with maybe the elderly, who knows, but currently, no, they're not on that sort of approved list or recommended list for boosters.
Okay, great. Dr. Cass, if you could provide this person a little reassurance. So they're asking, how can we be sure there is no long-term risks for children if there has been no long-term studies?
So again, an excellent question, and we continue to sort of follow the data as it emerges. I do think we can draw upon our knowledge and decades of experience with vaccines, that if this is if the idea of a vaccine is that it creates antibodies, which we have in our body already, and that a component of our immune cells, which are trained to recognize and be sort of at the ready to produce these antibody proteins that are protective, knowing that this vaccine technology, like many other vaccines that we've seen and worked with before, including, I believe, the Ebola vaccine, which was based upon a similar mRNA platform, does not in any way change my DNA. It doesn't make me a different person. It doesn't get into my eggs. It doesn't affect any of my cells. Then really there should be, as best we can understand from decades of science in immunology and vaccine treatment, and by the way, our long-term follow-up of the Ebola vaccinated individuals, then there's absolutely no scientific reason to believe that this vaccine in any way will affect our children and their growth and their DNA, because that's just not how this science works. And that has not been seen with our longer term follow-up of a related vaccine, as I've described with the Ebola. So this is just another mechanism to generate antibodies. It doesn't change who you are and your DNA.
All right, just one more question on boosters. There's been a few people asking about boosters. So this one wants to know, do you have guidance regarding the booster for pregnant women? So what's your overall, what are we saying about that with the boosters?
I think we just have to be patient and wait and see what comes out over the next few months. But I wouldn't be surprised if sometime over the fall or winter recommendations come out for people to be revaccinated. And I know this is a super controversial subject, and how can we think about vaccinating people again in the US when the world hasn't been vaccinated yet? I won't approach that one for this, but I think if women who are pregnant are offered a booster because they work in healthcare, they work in a long-term care facility, then I would take that opportunity to get revaccinated.
All right, we have a staff member who's currently pregnant. Congratulations. And they also have an 18-month at home, so they're very busy. I'm hoping once I start lactating again that I can give my toddler some of my breast milk to give her antibodies. Does this work? How much would I need to give her in order for it to be effective? That's an interesting question.
Yeah, it's an excellent question. And I think the short answer is, I don't know, Julie, if you want to chime in, but I don't think we know, right? And this is sort of the vexing thing about vaccines, is that we don't really know the magic threshold of antibody at which you are safe. But notwithstanding, I don't think that we had any sense of how much breast milk and how many times a day you'd need to give your toddler in order to protect your toddler. And I'm very optimistic that in the meantime, we will get some guidance from the Centers for Disease Control and the FDA about adapting what we've learned about the vaccine in older populations, 16 and older or 18 and older, to our youngsters, so that they too can be eligible for the vaccine very soon.
All right, just a reminder for our viewers, I just want to let you know, if you do have to jump off, it's totally fine. We are recording this, so we will have it on the intranet as well. For those who are continuing with us, please continue to use that chat box for the Q&A if you have any additional questions. So we have another one, Dr. Braga, is there time during the pregnancy when it would be safer to get the vaccine?
Yep, that's something that comes up a lot, and currently we are not differentiating as to the best time to get vaccinated. Really, whenever you're ready and it's available, anytime during the pregnancy is perfectly fine to get vaccinated. I think it doesn't make sense to wait until like the day before you're going to deliver, because then it doesn't give time for your body to make those antibodies and pass them through the placenta to the baby. So that would be the only caveat, is like, don't wait till the very last minute. You want to give a few weeks to let those antibodies in your system develop. But it's okay to do at the very beginning of pregnancy. It's okay to do in the middle of pregnancy. Really, we're just trying to get as many people vaccinated as possible.
Excellent. This could be for either one of you. I have had multiple miscarriages, and I know it was stated the vaccine does not increase your chance of miscarriage. However, if you're already at risk for miscarriage, is it still safe in that manner, or could it put me at more risk if I've already had multiple?
That's, again, I think it's so hard when you've been through miscarriages or infertility. I know women are so protective of their bodies and, want to make sure they're doing everything possibly that they can do to have a healthy pregnancy. But there's really nothing about a vaccine that should increase a miscarriage rate. So I think, I would just try to compartmentalize it as like a totally different thing, and it won't affect your ability to get pregnant or stay pregnant. And like I said, I think, if you're in between pregnancies, then now might be a great time to just get vaccinated and get it out of the way before you're in that, uncomfortable early stage of pregnancy.
Mm-hmm. Dr. Cass, if I have already had COVID, what is the additional benefit of vaccination?
That's a wonderful question. The additional benefit of vaccination is that the antibody levels that are achieved with vaccination are so much higher than what is achieved with having had COVID. Not only are those antibody levels from the data higher, way higher, but they also seem to stick around a lot longer, thereby protecting you from getting COVID again. And so I think vaccination for many people, we have to be really clear. It's just so much more additional protective clothing than you could possibly count on just having had a COVID infection. So you want to do everything you can to protect yourself, and for as long as possible.
All right, here's another great question. More for reassurance. This COVID-19 vaccine can only be given to children who are up to 12 years old. So what made it safe for fetuses and not safe for children less than 12? What kind of reassurance can you give on that?
So I think the main difference that we can say is that when a pregnant woman gets the vaccine, the medication that's in the vaccine does not go to the baby. It's not like we're injecting the fetus with the vaccine. The vaccine itself does not cross the placenta. What it's doing is it's going into your arm, and it's telling your body that, tricking your body into thinking it has the infection in your arm. And that's making your body's immune cells make the antibodies, which are something that your body makes to fight off the virus. So if you think about the vaccine as staying kind of here in the arm, just telling your body to make the defenses against the virus, it's not that you're putting the vaccine right into the baby. So I think that's, in my mind, the biggest difference. I think it's also that giving children a vaccine, they have to go through these very rigorous trials in order to get it approved for children through the FDA. That was not done for pregnant women, in that the studies did not intentionally include pregnant women. Our group of OBGYNs advocated very fiercely in Washington, everywhere, to try to get pregnant women included in those studies. But because of the sort of hesitancy to do any trials on pregnant women were not included in those studies. Children, they are now including in studies, and they are going through those steps to get the proper approval through the FDA to give it to children. So it's kind of a completely different process. But I think that's how I try to explain it to patients, that it is safe during pregnancy because the vaccine itself is not getting to the baby.
And the data that we have from pregnancy comes from the fact, and again, you all who are on this call can identify with this, there happen to be hundreds of thousands of women who were actually pregnant that did get vaccinated because they were health workers, because they were at risk, because they went on to then conceive and have children. So there is a large amount of information about how did pregnant women who got the vaccine, how did they fare? But in many cases, it was because they had other risks, as I say, including being healthcare workers, et cetera, that resulted in them getting vaccinated. So we do have some information, happily enough, to look to from pregnant women who were vaccinated with respect to outcomes for pregnancy. But children who get all sorts of vaccines, it is a very rigorous process, and we're just going to have to be patient to wait for all of the necessary steps for the Food and Drug Administration to go through before we clearly see that that's advocated for our children.
Here's a great question from someone who's considering the vaccine. If I get the vaccine within this week, I would be scheduled to receive the second dose at 38 weeks pregnant. Do you think this is safe? Is there a possibility of going into labor early? I'm also concerned about risk of blood pressure issues and stroke if I go into delivery shortly after the vaccine. How would you analyze this risk?
I think it would be perfectly fine to get it now and get your second dose at 38 weeks. There's not any data from that group that we talked about with the 140,000 patients or so to show that women who get the vaccine have higher risk of high blood pressure or stroke or any of those complications. Those are exactly the kinds of things that they're looking at in this study. So I think it would be perfectly fine to get it now and to get the second dose at 38 weeks. And that way give yourself good protection through the third trimester and give your baby some protection after he or she is born.
Here's a great question for either one of you, if you both want to weigh in. In what situation would you not recommend the vaccine for pregnant women?
Really, the only people who it's not recommended to get the vaccine are people who've had like anaphylactic type of reactions to other vaccines that are somewhat similar. So that's really the only contraindication. Right, Ilana? Is there anything
Absolutely.
else you've heard of?
That's the only contraindication. Yes.
Has there been any correlation with the vaccine affecting menstrual cycles?
So
You
Julie,
know that?
Yeah, so I'm sure that you have had a lot of questions about that. What has been described anecdotally is that there can be some menstrual irregularities, and to be very specific, patients reported skipping a period or having an extra period. But it's very difficult with the complex process of having your period to separate out what might be related to stress versus vaccination. But it absolutely has been described that some people have had, as I say, either a skipped period or some bleeding after their vaccination. It is not in any way known if that's worse with the second vaccine versus the first, and does not in any way alter resuming perfectly normal menstrual cycles after the vaccine has been administered. But again, there could well be a component of stress that really clouds that picture.
We have had a few viewers who are actually, they've been hesitant because they're concerned about vaccine side effects. So a few of them are asking, are there any risks from vaccine side effects like fever during pregnancy? Any suggestions on how they would be able to manage these effects when they get vaccinated?
Yep, I mean, it is very common, especially after the second dose, to have a fever. I think it's around 15% of people reported a fever after their second dose. The first dose was a much lower rate. And, you know, the fever tends to be, you know, not super high, not really long in duration. But it is recommended that women who have a fever of whatever origin during pregnancy try to avoid having a very high fever or having prolonged fevers. And the way to stop that is by taking acetaminophen, so which is perfectly safe during pregnancy. So we do recommend if someone gets the vaccine and then they have a fever, it is recommended to take a dose of Tylenol or acetaminophen to kind of bring that fever down. But I think, you know, it would take a very high fever, a very prolonged fever, especially, you know, really at the very early parts of pregnancy to cause problems for the pregnancy.
All right, we have one last question that looks like it came in, and they're concerned about unvaccinated family members. So maybe you could help them how to convince their family members as well to get the vaccine, because what they're asking is, how do they talk to family members about that they don't want them to see their newborn if they aren't as well vaccinated?
What's your pitch, Ilana?
So I can certainly tell you my pitch, because I deal with this every single day with my patients, you know, many of whom have cancer and are being treated for their cancers with chemotherapy or treatments which compromise their immune systems. And I tell those patients they all fit the criteria of high risk, and they have, you know, sometimes unvaccinated members of their family. And my plea is, you're here today to see me, to treat your cancer, and do everything you can to keep yourself healthy and to fight this cancer and make things better. And part of that includes not only you getting vaccinated, but your family members getting vaccinated as well. So really, this is about the entire household taking care of itself, doing everything we can to improve, you know, what our journey looks like with healthcare and things that we can own and direct. Because We all want to get to a place where we get back to some sense of normal, where we are not sentenced to having to wear masks more and more and inside. And that means, in addition to the counsel that I give all of my patients about smoking reduction or cessation, about a healthy diet, some form of exercise, it also front and center has to include everyone in the household getting vaccinated.
Mm-hmm. Well, we've really cut through the clutter here on everything. So I'm so thankful to have you both. And I think what we need to do, because there's been so much information shared, is let's get like a few takeaways that you really want our viewers to understand, to help empower them to make that decision to get the vaccine and alleviate their concerns. So Dr. Braga, what would you like to wrap up with and share?
Well, I guess one thing we didn't talk about is that currently in the US, only about 23% of pregnant women are vaccinated. And that's compared to more like 50 to 58% of all eligible people. So, we understand that there is a lot of hesitancy out there. And that's why we're trying to do, more of these information sessions. But I think, hopefully something that will be convincing to people is that, I really look at like one of my most important jobs here as being, my job is to make sure people have healthy, safe pregnancies. That's what I want to see. And I think that vaccination is really one of the key things, whether it's, a flu shot or whether it's the COVID vaccine or a Tdap during pregnancy. Those are really important ways to have a healthy, safe pregnancy. And that we're all kind of, hopefully looking for the same goal in the end, and that's a happy, healthy baby. And, I just wanted to say also that we're happy to chat more with you individually. If you have questions, I just call the clinic or message the clinic through my IDH, and I'd be happy to try to set a time aside to talk with you personally. This is really, really important to us. I've had a couple of patients recently that we've taken care of who are pregnant with COVID and have been so sick that I just want to, it just breaks my heart to see them go through this. And I don't want any other patients of mine to have to be that ill.
Yeah. And Dr. Cass, we also have someone who's writing in, they just emailed, who's still a bit concerned about the limited data that might be out there. So let's give your key points about how can we reassure people that it is in fact safe when they don't feel like they have the data that's out there just yet, and where would you recommend the trusted sources? Where would you recommend that they go to?
So I will start with my conclusions. The vaccine is safe, it is effective, and it is easily accessible as healthcare workers at DH. The website and the link includes all sorts of places that you can get vaccinated, including drive-through clinics, including setting up an appointment, but this vaccine works. Individuals who are pregnant, we know, unfortunately, are more susceptible to all of the bad outcomes that you see every single day as a healthcare provider. You have a bird's eye view of what it looks like when things go really wrong, and people are unfortunately have to be in a hospital, in an intensive care unit. And we just want to emphasize that there is really solid data from multiple sources which has then been used by our guiding societies to dictate to us and tell us the best science and the best practice, and it all uniformly 150% endorses vaccination to keep us safe and effective and protected, so that everyone can have sort of the family that they want, a healthy, happy child and a healthy, happy pregnant person. And that's really what we're all about. And that's the purpose of this session, to try to reassure people. We are here to talk about this and really just share our knowledge, recognizing that it's not perfect. We're going to have to be patient with some of the remaining pieces of information, but what we have clearly endorses vaccination for everyone who's pregnant.
Well, thank you both for sharing your expertise, and thanks to everyone who tuned in. If you feel like you didn't get your questions answered, or if you have additional questions, please check out our frequently asked question page on the dh.org. That has a lot of excellent information that we continue to update, and we will be updating after this with the information that Dr. Cass and Dr. Braga has shared. This recording is going to live on the intranet, so please be sure to check that out and share it with any of your colleagues who might not have been able to join this. And right on that homepage on the intranet, you'll see the top story is how to click to get your vaccine. There's plenty of opportunities, including coming up in the next few days. So please go ahead and make those appointments if you're interested and able to. We hope that we've answered most of your questions, and we are so fortunate that we've had both of you here today. So thank you, Dr. Braga and Dr. Cass, and congratulations to our viewers out there who might be pregnant or who are new moms. Thanks everybody.
Thank you, Audra.
Thank you.